Hello, my name is Dr. Dewan S. Raja. Today I will discuss about maple syrup urine disease, MSUD. What is maple syrup urine disease? Maple syrup urine disease is a rare inherited metabolic disease. This is an autosomal recessive disorder which affects the body's capacity to metabolize specific amino acids, which serve as the building block of proteins. The term maple syrup urine disease was used to describe this disorder since one of the defining symptoms is the smell of sweet maple syrup like urine. Maple syrup urine disease is caused by changes in the gene. This is a genetic mutation that produces the enzymes needed to break down branched chain amino acids like leucine, isoleucine, and valine. These are essential amino acids, very important for our body, very important also to produce the neurotransmitter in the brain, also important for the muscle function. So these are not properly metabolized. Okay. Here, what are the types of maple syrup urine disease? We have 4 types. We have also other types. These are the common 4 types. But remember that maple syrup urine disease is a very rare disease, and among the types, this is the most common classic maple syrup urine disease. This is the most common and severe form of the disease. It is caused by deficiency of the enzyme branched chain alpha ketoacid dehydrogenase complex, BCKD. Intermediate maple syrup urine disease. This form of disease is characterized by a partial deficiency of the BCKD enzyme complex. So this manifests in the very early life. So maybe within 72 hours of birth, we may get the manifestation of classic maple syrup urine disease. This type may come later during the late childhood or adolescence period. Thiamine responsive maple syrup urine disease. In this type of maple syrup urine disease, individuals have a genetic mutation that causes deficiency in the thiamine dependent branch chain alpha ketoacid dehydrogenase enzyme. Here is because it is thiamine dependent, so this is managed by giving thiamine, that is vitamin B1. Another one, rare one, E3 deficient maple syrup urine disease. This is a very rare subtypes of maple syrup urine disease caused by deficiency of enzyme dihydrolipoyl dehydrogenase E3 within the BCKD complex. It is a very rare subtype, but its manifestation is severe like that of the classic maple syrup urine disease. So what are the symptoms and complications of maple syrup urine disease? We'll have maple syrup odor of urine, maybe the wax of the ear, maybe the odor of maple syrup of the sweat, overfeeding, vomiting, lethargy and weakness, hypotonia, seizure, neurological impairment because of maldevelopment or non-development or defective development of the neurotransmitters, and also damage to the brain that causes neurological impairment, gait and movement disorders, ketoacidosis. There is excessive keto acid in the system, like that of the acetoacetic acid, beta hydroxybutyric acid, acetone, coma, and death that may follow. Okay, this is the complication: ketoacidosis, coma, and death. Okay, so we got symptoms and complication. Diagnosis: newborn screening. Okay, usually the newborn has gone through screening for the diseases, including maple syrup urine disease in many countries, including United States of America. Blood is drawn from the heel of the newborn. Okay, then a lot of screening is done with that blood. Maple syrup urine disease is one of them. Urine analysis of a patient will get the amino acids and its metabolites in the urine. Also blood amino acid analysis, serum amino acid analysis to find out the accumulation of the amino acids in the blood, and also the serum, genetic testing, enzyme assay. Okay, so we got symptoms and complication. We have the ketoacidosis, coma, even we may have cerebral edema and death. Death is common if it is not treated properly, this is not managed properly or quickly. Pathogenesis: babies with maple syrup urine disease lack an enzyme necessary for processing amino acid leucine, isoleucine, and valine, which are found in food rich in proteins such as milk, meat, and eggs. So this amino acid or its metabolite may be accumulated in the body if they are not correctly metabolized, because it is not correctly metabolized in this disease, giving urine an unpleasant aroma like maple syrup or sweet brown sugar. These infants are typically quite fussy, very irritable, and have poor appetites. Maple syrup urine disease can result in mental impairment, physical handicap, and even death. There may be a chance of cerebral edema. This complication can be avoided with a careful, regulated diet devoid of high-protein meals. Incidence: there is a new case in every year is 1 in 250,000 in the United States of America. Treatment of maple syrup urine disease: low protein diet, medical formula, genetic counseling. It's very essential to find out the genetic profiling of the family members and to give some advice for future family planning. Neurological and developmental support: we need support of the neurologist, the physical therapist, speech therapist. Liver transplantation is also important. It may be done in the early childhood. Liver transplantation, that gives a lot of benefit. It is a good way to decrease the complications of the maple syrup urine disease by liver transplantation. And that's all about the maple syrup urine disease. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.